Good afternoon,
Добрый день,
everyone.
уважаемые
It's my
коллеги.
pleasure to
Мне очень
deliver
приятно выступить
a
сегодня
talk
перед
on
вами с
anti-glaucoma
презентацией по
medical therapy
медикаментозному лечению.
beyond the drop. I'm Dr. Ningli Wang from Beijing Tongren Eye Center. As we all know, glaucoma is a leading cause of the irreversible blindness. The number of the people with glaucoma worldwide will increase to 111.8 million by year 2040. The primary open-angle glaucoma remains the most common subtype. The current treatment strategy has been changed with the increasing understanding of the pathogenesis of glaucoma. The previous treatment target was lowering the intraocular pressure. However, the optic nerve damage persists in almost 50% of the patients despite the significant IOP reduction. Meanwhile, the normal tension glaucoma for more than 8% of the open-angle glaucoma in China. Therefore, besides lowering the IOP, more and more researchers suggest protecting against the retinal ganglion cells death can be considered as the primary goal of the glaucoma treatment. There are many neuroprotective treatment options, such as stem cell therapy, gene therapy, electrophysiological therapy, and photobiological therapy. However, those therapeutic regimes are still in the lab and need much effort and time to apply to clinic. Pharmacological neuroprotection seems to have a bright future. Oral neuroprotective anti-glaucoma medication are safer and more consistent with the principles of the whole life treatment. Most importantly, we can select the medication individually based on the risk factors of the primary open-angle glaucoma. In the following time, I will highlight several much discussed pharmacological neuroprotective strategies in glaucoma and our work in this area. The first discussed neuroprotective treatment is the vascular regulation therapy, since hypoperfusion is one of the pathogenesis of the primary open-angle glaucoma. Vascular regulation impairment and systemic hemodynamic abnormalities may be contributed to the onset of the disease in some normal tension glaucoma patients and disease progression in patients with IOP-controlled high-pressure primary open-angle glaucoma. In previous studies, calcium channel blocker and ginkgo biloba extracts have been used as a neuroprotective medication due to their ability to modulate blood vessels. However, their effectiveness remains controversial, and it may not be beneficial in all primary open-angle glaucoma patients. Patients with primary vascular deregulation and often defined as a Fleming syndrome, which is commonly presented in the primary open-angle glaucoma patients, especially in the normal tension glaucoma. We have proposed a series of the study that microcirculation assessment should be performed in the open-angle glaucoma patients, and the vascular regulation therapy is a feasible treatment strategy for the patients with open-angle glaucoma who have the vascular dysregulation. One of the easy way to elevated the whole body's microcirculation is to detect the nerve fault, and it can be used to identify the people with vascular dysfunction. We found that the nerve fault microvascular density correlated with the retina vascular density, and also the nerve fiber layer thickness in the healthy individuals. One of the cross-sectional study did by our team found that in the healthy population, the apparent cessation of near microvascular after the cold production is associated with the lower density of the prepupillary blood flow of the supratemporal regions, which indicate the similarity periphery microcirculatory impairment in health control, may also contributing to prepupillary capillary damage. In recent study, prepupillary capillary damage have been proved to precede the onset of the retina nerve fiber layer defect, and our study also show that the systemic vascular dysregulation is associated with the corridor microvasculature dropout at the site where the glaucoma occurs. Therefore, use OCTA and near-field capillary scar can initially determine the high risk of primary open-angle glaucoma patients who suffer from the ocular blood flow disorders. It is important to evaluate the primary open-angle glaucoma patients' systemic and microcirculation conditions through a near-field capillary scope and OCTA after definite diagnosis to exclude the possibility of the vascular dysregulation. For patients with apparent vascular dysfunction syndromes, a neuroprotective treatment should be considered as a key component of the anti-glaucoma medical treatment. Next, I would like to talk about vitamin supplementation therapy, which also another hot topic in recent years. Multivitamins and their metabolites, such as vitamin B12 and vitamin antioxidants, have previously been associated with glaucomatous neuroprotection. In recent studies, vitamin B3 and vitamin A are also proven effectively in neuroprotection. Vitamin B3 have been considered the most promising treatment option in recent years. Related basic research published in the Science have achieved much attention. As a derivative of the vitamin B3, nicotinamide is a precursor of the NAD, and it is a supplementation can significantly increase the level of the NAD in mice. Williams and his co-work observed that the optical ganglion cell in glaucomatous mice are associated with significant mitochondrial dysfunctions and abnormal expression of the gene related to the oxidative phosphorylation pathway. They are proposed the NAD level in ganglion cell decreased with age, making the aging ganglion cells susceptible to the glaucoma-related damage, and supplementation of the vitamin B3 in mice achieved neuroprotection against the glaucomatous nerve fiber layers damage. To date, vitamin B3 have shown promising results in the basic research, and its efficacy in slowing glaucoma damage have also been well proven. Currently, several clinical registered studies hope to confirm the productive role of the vitamin B3 in disease progression. However, nowadays, only short-term therapeutic effects have been reported, and its ability to be used as a long-term therapeutic agent for the glaucoma remained further confirmed. Our teams recently proposed that the vitamin A may have the potential to be another important target for optic neuroprotection. High dietary vitamin A intake is a non-ROP targeted protective factors in open-angle glaucoma. Two meta-analyses on the nutrients intake in the primary angle glaucoma in year 2018 and year 2021, respectively, indicated that among the multiple nutrients, vitamin A intake was strongly associated with the development of the glaucoma, especially open-angle glaucoma. From the year 2008 to the present, 5 population studies suggest the high vitamin A intake reduces the incidence of the open-angle glaucoma. In our recent cross-sectional study, we found that serum retinol level in patients with normal tangle glaucoma were significantly lower than in the controls and high-pressure glaucoma patients. 13.6% of the patients with normal tangle glaucoma have a marginal vitamin A deficiency. We also found a positive correlation between the optic nerve sheath damage and serum retinol in glaucoma patients. This suggests that the normal tangle glaucoma patients' lower vitamin A level may be associated with the onset of the disease, which may be related to abnormal translaminar corpuscle pressure gradings. It is the possible mechanism of the vitamin A in disease pathogenesis remained unknown. Retinoic acid, working as a derivative of the vitamin A, plays an important role, performing physiological function in a variety of the organs. In previous animals experiments, it has been shown that the vitamin A derivative have a protective role in acute optic nerve injury. At the same time, we proposed several mechanisms for the involvement of the vitamin A in glaucoma neuroprotection. First of all, the vitamin A may be potential target for regulating translaminar corpuscle pressure grading in normal tangle glaucoma patients. The lower intracranial pressure or the high translaminar corpuscle pressure gradient is an important potential risk factor for normal tangle glaucoma. Previous studies have proposed that vitamin A's toxicity can cause elevated intracranial pressure. Vitamin A is converted to a retinoic acid in a corridor's plaque epithelium cell that produce a cerebrospinal fluid, and in ependymal cell they absorb the cerebrospinal fluid, affecting the expressions of the different types of the aqueous channel proteins, which may play a role in the intracranial pressure regulation in glaucoma patients. Secondly, vitamin A also has a potential role against the oxidative stress damage as a natural antioxidant product. The ganglion cells are impaired in the cellular metabolism due to the high intraocular pressure, ischemia, hypoxia, and exoplasmic fluid damage, resulting in excessive ROS production. Excessive ROS causes oxidative damage in the retinal ganglion cell. Varieties of the natural agents, including vitamin A, are thought to have a potential to inhibit the oxidative stress damage. Finally, vitamin A and its derivatives have also been considered to acquire neuroprotective effect in glaucoma patients by inhibiting the synthesis of the alpha, which have been thought to be associated with the central nervous system degeneration. Based on the current clinical studies and basic experiments related to the vitamin A, could vitamin A supplementation be a next target for glaucoma optic nerve protection? This is the next question that needs to be answered. Finally, there are still other kinds of pharmacological neuroprotection protocol under the investigation. State endothelin receptor antagonists, glutamate antagonists, and neurotropic factors have been studied in the recent years with a varying degree of the progress. All of these are neuroprotective agents that have potential to be used in clinical practice in the future. In addition, traditional Chinese medicine is also a promising unique treatment directions for glaucoma. We are also paying close attention to that, and we also bring you a special report on relevant progress in future. In future research, we will try to answer the following three questions. Questions 1. Which medication would be the first optic neuroprotective agent to be proven effectively in humans? The number 2. Can gene therapy and endogenous stem cell regeneration make the breakthrough? The question 3. Can traditional Chinese medicine be combined with Western medicine to make a breakthrough in glaucoma neuroprotection? These all are shared today with my audience. Thank you for your invitation. Thank you, audience attention. If you have any questions, please don't hesitate. Send the email to me. Thank you.